My name is Rosalind Picard. I'm sitting here in my office at MIT Media Lab in Cambridge, Massachusetts. We're hosted today by Empatica, a company that I had the privilege of co-founding and working with a bunch of super people to try to build technology to help improve the lives of people with epilepsy. And I am thrilled to be here today with all of you, and especially with our two doctors on this call, Dr. Patrick Brown and Dr. Julia Das. In my work at MIT, we do a lot of work with mental health, and anxiety disorders are the #1 mental health disorder in the world, followed by depression. And we know that people with epilepsy in particular struggle a lot with anxiety. So I'm thrilled to have both of these two experts here to help us think about how to improve lives and reduce anxiety, improve the experiences of those living with epilepsy. So who do we have here today? We have Dr. Patrick Brown, who is waving here. He's from University Hospital Rainbow Babies in Cleveland, if I got that right. And one of the super cool things about him is he's not just a pediatric epileptologist, but he also has epilepsy. So he really understands this both as a personal experience as well as through learning so much from so many patients. Also, Dr. Julia Das, who's been working with Patrick for a while. She is a licensed psychologist with her own practice in Minneapolis, Minnesota, and she has a long-standing career working with children, adolescents, and families, managing medical illness, chronic medical illness like epilepsy, and in particular, helping people with complex anxiety and depression conditions. So thank you both for being here. Super excited to have this time together. I wanted to start by, our goals today, we're just going to talk a little bit about the link between epilepsy and anxiety. We're going to hear from Julia and Patrick about coping strategies for managing anxiety. Then we'll have some time for Q&A. We probably won't have time to answer all of the questions. If there are extras, we will do our best to maybe get back to you afterwards with answers. All right, so without further ado, Julia, what is anxiety and when does it occur in epilepsy?
Well, first, thank you guys for having me. I am really happy to be here and talk about this. It's a passion of mine to be working with people with epilepsy. I've been doing this for 20 years, and it grows and changes every day. And what I want to say first about anxiety is that it's both an emotional thing that people experience, but it's also a physiological thing that people experience. And anxiety, regardless of the reason people have it, is I think of it this way: it's our body's way of protecting ourselves. It's this kind of core way that our body reacts to situations outside of us and things inside of us to protect us. But unfortunately, sometimes that protection actually causes more problems. And so that's what I think we're here to talk about today, is when anxiety becomes something that gets in people's way, causes more problems, and makes life a little bit more difficult when you're already dealing with a lot of really challenging things. So in epilepsy, there's a couple of different ways that I have seen anxiety for my patients who experience epilepsy. I work with kids, but I think this also applies to adults. When first diagnosed with epilepsy, it's a really overwhelming experience for a lot of people. Often it comes on very quickly. It's something that you're not expecting. The first seizure can be very scary. The second seizure can be very scary. I mean, there's a lot of fear around the actual symptoms themselves. But one of the things that I think is true for most people is that when you feel out of control, you become anxious. And so what's the thing that we know about epilepsy? Seizures happen when you don't know they're going to happen. They come on unexpectedly. They come on at times you don't want them to come. And sometimes there's an aftermath that's really uncomfortable. And all of those factors are out of the person's control who's having the seizure. And so there's a real natural fear when this first starts and continues that there's this component that you can't grab a hold of and take control of yourself. And so you need professionals to help you. You sometimes need medication to help you. And that can be scary too, when you're trying to give over your life essentially to someone else and say, please help me. How can I get this better? How can I get control of my life again? And so when it comes to anxiety related to the diagnosis, that's what I see. And when I'm working with families with young kids and teenagers, it's the parents too. It's the family members who experience a lot of fear. You know, how do I help my child? How do I make sure they're safe? How can I send them into the world, which is already a scary place, with this thing that makes them vulnerable? And so when it comes to the actual diagnosis, there's a whole range of things that come along with that that are very important, in my opinion, to talk about as soon as the diagnosis happens, because they're there and they're real. And they are things that impact how the person understands what's going on with them, and also how they will eventually manage it as they, go through the process of hopefully being able to discover the things that work for them to control their seizures. Another place that I see anxiety and epilepsy has to do with, kind of an aura. Some people experience a pre-seizure kind of set of symptoms that for some people with certain types of seizures can be anxiety. So they might notice, I'm starting to feel that way. Uh-oh, this means I'm going to have a seizure probably. And for some folks, that can be really terrifying, because while not knowing it's going to happen is scary, knowing it's going to happen without being able to stop it is also really scary. So it's this really challenging situation in that way as well. And one of the things that we're understanding more and more, and we need to continue to do more research on this, is that some of the parts of our brain where we have seizures are also the same parts of the brain that control our mood and control anxiety. And so sometimes when you have seizures and it affects that part of the brain, you become more prone to developing anxiety because that part of the brain is being affected by the seizures. It's not true for everybody, but that is something that we see with some folks with epilepsy as well. So I think those are the primary, if I'm kind of thinking of how I see this playing out with folks who have epilepsy, those are the most common ways that I see anxiety showing up for people.
Thank you. I love that you're emphasizing things not only that are directly related to that experience of getting the diagnosis and all, but a common thing I've seen for everybody is when you increase the uncertainty in somebody's life, you can increase the anxiety and the uncertainty of not knowing when a seizure is going to hit, or as you say, also that it's likely to hit, but you don't know exactly when or what it's going to happen, what it's going to cause to happen. Those just compound the stress. So that's, really hard to deal with. Mm-hmm. I was learned that you might know better statistics than this, but that at least 25% of people are affected by anxiety, like at a disorder level, not just kind of regular anxiety, but really bad anxiety. And in a study by a French researcher, Coraline Hingray, in 2021, they found that it was a stronger influence on quality of life than was depression or seizure frequency. And having, that greater anxiety was also associated with poor epilepsy outcomes. So learning the best tips for how to manage it, might improve quality of life and epilepsy outcomes as well, which we'd love to help people with. On that note, Patrick, do you think neurologists are discussing anxiety enough with their patients? Do you discuss it with your patients?
Yeah, you give me the softball question. Thankfully, I think, we're fortunate to hear that from Julia, because that's such a great, breakdown of what families come to you, when they're in the middle of epilepsy or when epilepsy's just begun. You really feel like these families are in the fire. There's anxiety, not even sometimes just for the patient, but for the entire, family unit. Now you got to hear Julia sort of discuss this in a really thoughtful way, but I think most families or patients with epilepsy aren't getting that sort of discussion like from their neurologist or from their epileptologist. And I wish that, I wish that were the case. I don't think, and we've been trying to get better, I think, over the last decade or so. There's definitely more research and awareness that anxiety plays such a crucial factor, like you talked about, even sometimes the most crucial factor when we look at quality of life in people with epilepsy. The anxiety we found isn't even necessarily related to seizure control. So you could have controlled epilepsy and still have, just as bad of an anxiety as people that have severe epilepsy. So the answer really, I think we're not talking about it enough with our patients. Lots of reasons for that. I mean, I think probably it goes back to maybe just the way we were trained, right? We were trained to focus on seizures. I've seen, some visits, not with me, thankfully, but that really the visit was, hey, how are you? Good to see you. Are the seizures controlled, not controlled? Should we go up on your medicine or not? And then we'll see you at your next follow-up, with really no time allotted to, how are you doing? Yeah, how's life? I was really fortunate when Julie and I worked together in a practice. We had a clinic that was called a new onset pediatric epilepsy clinic. And we really did just that. When she talked about from the diagnosis, really trying to understand if a patient has anxiety or not. We've also seen that anxiety can exist before the diagnosis of epilepsy. So like our fancy word for that is that there's a bidirectional relationship, or kind of like there's a two-way street. So we can see that anxiety can pre-exist the diagnosis of epilepsy. So really just from the very beginning, having that conversation, and even if there may be, and Julie can maybe speak to this a little bit, there may not be a diagnosis of a specific anxiety disorder, but still paying attention to and possibly treating and managing the anxiety that exists, around epilepsy. So you may not necessarily meet criteria for a specific anxiety disorder, but still we've got to pay attention to it. Yeah.
I think I have your permission to ask you this. Have you had, we were joking earlier, like you might jump off of the call. Have you had personal experience of anxiety from having epilepsy? And are you comfortable sharing a little bit about that?
Sure.
So, yeah.
Yeah, sure. So, and I don't know, Julia, would probably maybe say I'm not like what I would consider a person that struggles with anxiety, but in terms of, so I had a seizure when I was 17, generalized tonic-clonic seizure. And like most teenage boys, I tried to put it out of my mind and pretend that it didn't happen. But, I was secretly going to the library, trying to pull out a book on, on epilepsy. This is pre-internet, feeling very isolated and alone in the diagnosis. And I think there was even, and unfortunately I only had one large seizure, but sometimes I'll describe it as the little kind of worrywart on your shoulder, or I don't know, there's a game show called Press Your Luck, and there's like a whammy guy that you don't want to hit. And there's almost like a whammy guy that lives on my shoulder sometimes that says like, today would be an awful day to have a seizure, or did you remember to take your medicine? I'm not sure, did you take it? Because it'd be awful to have a seizure right now. And then, I think of myself as a guy that doesn't really have anxiety, and I'm talking to this, this anxious voice that's like, boy, yeah, let's not have a seizure now. And I want to say, well, it's been 30 years, man, you can shut up now. But that voice is still there from time to time. And so, I think for me, that's sort of how I've seen it. Or even just, again, the anxiety around, I always tell families epilepsy would be a different sort of disease if you knew precisely when and where you were going to have a seizure, right? If epilepsy told you, well, next Thursday at 5:30, there's going to be a seizure, so get ready. But I think that fear around what's going to happen and what's it going to look like and where would I be, I think that's really real. Even for me, a guy that's had like very well controlled epilepsy. So that'd be my answer to that.
Thank you. I mean, I'm sure people feel like if even you, who has all this expertise as an epileptologist and, has your epilepsy hopefully continue to be well managed. Hopefully, wish nobody on this call would ever have another seizure again, you know. But even you having sometimes that little voice, you know, you have to deal with that. And that's still a challenge. What do you see most frequently in patients related to anxiety and epilepsy?
I may punt this one to Julia for a second. Julia, do you want to take a stab at this, and I can sort of talk about what I see?
You know, I think it varies so greatly, honestly, from people who have, depending on the type of seizure, when they have it, how often. There's just so many variables. But I think when I think about the kids that I've worked with, the thing that, if we're talking about kind of like situational anxiety, meaning like the things that impact your everyday life, people are very anxious about their safety, and they're very anxious about people's perception and social kind of like, how do I manage this in the world with people? And kind of back to what Patrick was saying, like today would be a really bad day to have a seizure. I'm in the middle of this thing. It'd be a really bad day to experience that. And I think that that is an incredibly common fear, that because there's this uncontrolled thing that's happening, or even if it's controlled, but this thing that could happen, this kind of thing that takes me by surprise, that isn't good, that doesn't feel good, and is scary for me and other people. There's a lot of fear of, how do I manage that and continue to have a normal life? And so even really young kids worry about that. And so I think that would be probably the thing that I have seen the most commonly, when it comes to kind of the management of the anxiety and seizures.
Yeah, I mean, I think. Oh, go ahead, Rosalind. I'm sorry.
No, I was just gonna say I'm kind of imagining, like, you know, you can imagine the worst, right? Like not only having a seizure at the worst time and injury, but like if you're a kid or a teenager around people who might not understand it and they're judgmental, you know, and they judge you in a totally inappropriate way because of it, you know, that could just make a bad thing worse, right? I mean, it's pretty scary. Yeah.
And I think I read an interesting article recently about sort of perceived stigma. We talk about stigma a lot, and we know epilepsy is sort of not alone, but kind of special in the sense of stigma that folks can feel. But sort of even the amount of like perceived or felt stigma can really impact someone's anxiety, right? And sort of like, I guess, what you're projecting on the world around you as how they're going to react, or how they even have reacted to your epilepsy in the past.
Yeah, I like to remind everybody I'm teaching about epilepsy that anybody with a brain can get epilepsy, right? Like you may think you don't have it today, you could have it tomorrow, next week, right? Like this could happen to everybody. This is not the problem of just some people with a diagnosis. It really is something we can all share concern about how to handle it better, help everybody with it. I want to switch a little bit to strategies for managing the anxiety because it's huge. And Julia, you were saying, you know, it can be very individual. What are some of those, you know, without knowing anybody in particular on this call, although some of them are starting to type in questions, seeking advice. What are the basic tips that you give to manage anxiety at home? Patrick, feel free to jump into.
Yeah, I think, you know, when we worked in that pediatric epilepsy, the new onset clinic, we would always spend a large portion of that session talking about how can you approach this, and kind of what I've been saying today throughout, is that feeling of being out of control. What can you control? What are the things that you can control? And one of the things that I think is really important to bring down stigma and help people to be able to kind of advocate for themselves is to know how to talk about it, know how to talk about the fact that they have epilepsy, and then tell people how they can be helped when they have a seizure. Because I think one of the things that scares people the most, besides being out of control, is seeing a situation that feels out of their control where they don't know what to do to help the person. And I think most people want to help other people. And if they know they kind of understand what's happening, they know what they can do to be helpful. They know how they can get that person help. It brings that anxiety down for everyone in the situation. And it also brings the stigma down. So one of the things, just to tack on to what Patrick was saying before, and Rosalind, you brought this up too, anybody can have a seizure. Anybody in the world can have one. One of the things that's really hard about the disorder is that you can walk around, and if nobody knows you have epilepsy, they won't know you have epilepsy because you're not telling them until you have a seizure. So the fear of having a seizure with people who you don't know, or people who don't know you have it, can also increase the anxiety a person experiences, because it's sort of this thing that they're protecting. Like, I don't know how people are going to react. I don't know how they're going to feel if they know I have it. So I'm not going to tell anyone. And then that increases anxiety as well. So some of it is learning how to talk about it. Some of it is being able to figure out how to control situations that you're in so that people can help you if you have a seizure, and knowing how to advocate for yourself. Those are kind of very important first things that I talk with people about. Patrick, what kind of things do you think are important in that first stage?
Yeah, I mean, I think you hit on a couple really important points. And one is most people, and I always ask my patients this, like, do you know anyone else that has epilepsy? And 99%, 90% of the kids that I see don't know another soul that has epilepsy. And so when it's appropriate, I'll sort of share my story a little bit with them and say, well, now you know at least one. But I think part of that isolation and that loneliness, and like Julia talked about, for a lot of these patients, you're walking around kind of holding a secret, and you're kind of carrying this secret that you're guarding really closely. And I think that can add to that level of anxiety. And what I tell people is sometimes, and this is what's made a huge difference for me, is that about a few years into my career, I had another physician come into my office, and they said, "Hey, I heard that you had epilepsy." And I was like, "Oh gosh, like where's this going to go?" And they said, "You know what? I do too." And they actually ended up having the same sort of epilepsy that I had. And I can't tell you how huge that was for me to realize, like, oh gosh, there's someone else that, like me, has epilepsy like me. And then that one friendship probably did more mental health wise in terms of my epilepsy than any number of therapy sessions or anything. Just knowing that, oh, there's somebody out there, I'm not alone. And I think, as basic as that sounds, I think there's so many families that are and can feel utterly alone in living with epilepsy. I talked with Tristan Thompson the other day, who's been vocal about his little brother who has epilepsy, and he was I think 11 when his brother was diagnosed, and he said, we had a great community. We had a church community, we had all these communities, but no one else had epilepsy that we knew of. So even within those communities, we felt really isolated and alone. And so I think something as simple as having a friend that's with you in this, I think can make a huge difference. I don't know. That's something that I feel like that's been helpful for people.
I'm going to jump to one of the questions because I think it resonates exactly with, and it was asked even before this came up. One of our listeners wrote, I have auras that feel like anxiety and fear, but I don't have a seizure anymore. It's nice to hear you talk about that. And then the question is, have you heard of any studies about connecting with a community with similar experiences to help reduce anxiety? Any studies of exactly what you just said you've seen that helps?
I don't know of any studies offhand. It would be a fascinating study to look at. It would be fascinating just to have people connecting, right? And so I think it's a great idea. I think anything that we can do to promote connection, but it's tougher than you would think, right? We have these in a couple of different organizations that I work with, they have support groups. So you think like, okay, well, we'll just have support groups and then people can meet like-minded people. And no one comes to these support groups in a lot of senses. There's some, but you would think like, where's everybody? And especially like teenagers, because no one wants to really just talk about it. I think there's such a barrier or to just saying, and I get it, because it took me, I had a seizure when I was 17, and it took me 10, 15 years before I could look people in the eye and say, I have epilepsy. And that's, to me, that's sort of what we're up against in a lot of ways. I do think also to that question, I mean, we certainly can see, and Julia talked about this a little bit with temporal lobe seizures, especially, that the same parts of the brain, when we think about the hippocampus, the amygdala, all of that same network that's involved in, the actual seizure can produce fear, can also lead to anxiety. And so sometimes it's tricky to tell kind of what we call like ictal fear, or a fear that's part of the seizure itself, from, anxiety and fear that's in between seizures. And it's really tough for us to tell sometimes.
I did the super quick search. Yes, there are studies online. I'm finding there's even a meta study showing exactly what Patrick says. There are peer support groups. However, if people don't go to them, it doesn't help. So it's interesting. There may actually be an opportunity to connect people, maybe technology, like we're connecting right now on Zoom, to connect people who can't maybe show up physically to the classic peer support groups, but could meet other people online, and maybe a matchmaking service that could allow them to find people like their age, their experience, and share tips.
Yeah, that was one of my goofy ideas all along. I probably shared it with Julia at some point, and I just didn't have the skills, or was too busy. Like, yeah, can we just match up people that would be, good fits? And like, how do you do that? And I think something like that could really be useful for folks. But yeah, I don't know. Julia, what do you think?
Yeah, as I'm listening, I think I also wasn't aware of any specific studies. So Rosalind, thanks for looking that up. I'll have to look at those after. But one of the things that I think we do kind of well here in our Epilepsy Foundation program is we have this camp. And so it's for kids. It's for kids from 8 to 18. And this might be a thing to think about as far as your matchmaking service. I think one of the reasons people don't go, and this is true for other mental health situations where people, or other medical situations, in fact, like if there's a support group that's about the disorder, it can be really overwhelming for people because they aren't sure, how much do I have to share? What am I going to hear? Am I going to go and feel worse when I leave? Like, this is kind of overwhelming. It's sort of like putting everything out there, like in this really kind of intense way right away, right? It's like, well, reveal, kind of like, here you go. But Camp Oz is what it's called, which Patrick has been a part of too. And this is a shameless plug for Camp Oz. It's just the most wonderful thing ever. But the kids go, and it's camp. It's about camp, but they all have epilepsy. And so in the course of a week at camp, kids from age 8 to 18 meet each other and learn their stories. Sometimes they'll talk about epilepsy. Most of the time they talk about, the people they think are cute. And that's what it is. It's camp, but it's with people that have had a similar experience, and they're all safe because there's medical people there. And so if we could come up with something like that for adults, I think that'd be wonderful. Something like that, where you're kind of going with a bunch of people who've had experiences potentially like yours, where you can connect and allow that connection to happen more naturally, rather than like a big kind of reveal, might lessen the anxiety for everyone too.
I know this. She's a producer out in LA, and she's worked on tons of reality shows, and so they're like, everyone's super creative. So the thing that they do, her and all of her super creative, Hollywood friends, they make a space camp for themselves that lasts, maybe 3 or 4 days. But it's like incredible because you have all these set designers and and all that. So maybe we'll just create like an adult space camp, and we'll invite folks with epilepsy there too.
That sounds fun. Just sounds like fun anyhow. Another question, and related to our topics we wanted to cover, is, anxiety medication, anti-epileptic drugs, like if you, one listener writes, in addition to increasing medication each time my son has a breakthrough seizure, what alternative things can be helpful in managing the physiological stress? They write, I am reading a lot about things like massage, acupuncture, and even the use of nicotine patches. No clue where else to begin.
I think, and I'll let Julia answer the sort of the other techniques, because that's her land, especially. But treatment wise, we do, and maybe years ago there was this fear that drugs to treat depression or anxiety would increase seizures, and I think we've seen over the years that that's really not the case, except for maybe like a rare, one drug that we look out for. So we know that the drugs that we use basically for depression, SSRIs, SNRIs, can be helpful for treating anxiety. And so I think that's an option. Do most neurologists feel comfortable using those? Probably not, but some maybe do, or I know, psychiatrists certainly do. So those drugs that are maybe specific for treating anxiety and depression. A lot of times we can use the drugs, the anticonvulsants or anti-seizure medicines that we use, can have some effect on mood as well. There's some that can worsen mood, some maybe even like lamotrigine, or others we know can maybe help with anxiety. We know the benzodiazepines can be helpful. And so, sometimes you can use your seizure medications, to help you also maybe co-manage some anxiety. But that wasn't the question. So now Julia will answer the question.
I think, there are a lot of things that you might find out there on the internet that that might be helpful and may not be helpful. And I think that's the challenge. It's so important to kind of connect with people in the epilepsy world who can guide folks in the direction of what is helpful, and also what's safe, and what will and what's been tested. And unfortunately, we're in the infancy, I think, still of testing some of these things and understanding where's the evidence for what works and what doesn't, as far as like the mental health aspects of epilepsy. But what I will say is that folks who have anxiety, or folks who have mood-related symptoms associated with their epilepsy, do often benefit from therapy. And so psychotherapy can be really, really helpful in teaching tools for management of anxiety symptoms, but also even to some extent in certain situations, how to help reduce some of the stress that can actually cause seizures. So there's a lot of different kinds of therapy out there. It can be hard to find a therapist who specializes in working with epilepsy. There are not a lot of us out there. But that I don't think is necessary. I think the most important thing is finding somebody who has an understanding of working with folks with medical illness, and there's a lot of those folks out there. And because there's components of that are important to understand. How do you cope with medication side effects? How do you cope with the symptoms themselves, et cetera? How do you advocate in schools and in workplaces if you're an adult? But the other thing is, so I'll give you some buzzwords of things to look for. There's a type of therapy called cognitive behavioral therapy, which has been really well tested. It's one of the therapies that a lot of people are trained in, and the evidence for it is that after a set number of sessions, people often experience a relief in some of their symptoms, especially with anxiety. It's especially good with anxiety. And so if you're looking for therapists, you might look for people who know how to do cognitive behavioral therapy. There's other therapists out there who do more what I would think of. It isn't called this, but this is how I think of it. It's a biological and psychological therapy combined, where they're teaching people techniques to manage their body physically. So meditation, relaxation strategies, different kinds of things that people can learn to do on their own at home after they've been in the therapy session to use when they're going to have a seizure, after they've had a seizure, to recover from it, to help decrease some of that emotional reaction that their body is having. And so those are, that would be one of the things that I would say I've seen a lot of positive change for folks when they go to therapy and they get that kind of treatment.
We've done work building digital therapeutics that support, come alongside that human therapeutic CBT relationship and help humans provide that. And that makes me wonder if one of these questions might be a good candidate for CBT. It's a mom writing, I have a 29-year-old son that is now a nocturnal epileptic, seizes about 3 times every 2 months. He stresses that he will never be independent and live on his own. I'm curious if you think that would be CBT. I find that kind of thinking like, I will never be able to do X.
Right.
Yeah.
I think that's a great candidate for CBT. I think one of the things, kind of back to what I said early, helping people figure out what they can control. Sometimes we can't control the seizures completely, and that really is terrible when that happens. But there are other aspects of life that you can control, and you can learn with a therapist and with a good neurologist, like everybody working together, helping the patient to understand, what can I control? How do I not let these symptoms make it so that I can't live as independently as possible? What are the things that need to be in place for me so that I can do that? How do I manage the anxiety I have, or the family member's anxiety, so that we can work on that independence, that sort of thing. So there's a lot of different kind of problem solving techniques that can be learned through cognitive behavioral therapy that can be really helpful, even if the symptoms of the seizures themselves continue. And I think that's, I say this, I don't know, multiple times a day to all the patients I work with. We're not going to let your symptoms decide what you're going to do. We're not going to let those decide. We're going to figure out how to work around them. And that is what cognitive behavioral therapy is. So I do think that's a good, that person would be a good candidate for that.
And you can see why a neurologist or an epileptologist would love to have someone like Julia working down the hallway from them. And so I think that maybe goes to just a team approach. And so your neurologist, no neurologist in the world is going to be able to tell you what she just told you in that sort of meaningful, eloquent way. But to have them to be able to call her on the phone, or someone like her. So I think the team approach is really helpful, so that when you go to see your neurologist, they're at least hopefully asking you about these symptoms. You've got enough time to sit with them where you're telling them, what your life looks like. And they can say, okay, yeah, are you seeing a therapist? How's that going for you? Is that do you have a good connection? Do you feel like that's been helpful? Great. If I need to talk with them and we can share information and any way that we can collaborate, I think that's going to give you, the best care that you can get.
I think that's great if the neurologist suggests that too, because a lot of people think it's stigmatized to go see a therapist. So, it's like double whammy, right? Not realizing that, there's experts who can really help you with your brain. You wouldn't, try to, I'm a computer expert, so I may try to fix my computer, but even sometimes I go to another computer expert to fix it, right? I go to a brain expert to fix my brain. So we all can benefit when we go to the right person to help us. There's another question, I think probably a common experience, from Nicole. My biggest worry is having a seizure by myself. I have always been very lucky to somehow have someone around me. What happens when someone is not there to turn me on my side?
Yeah, I don't know, you probably hear this all the time too, and this is something I hear from families and patients all the time, whether it's, you know, at the very beginning of a diagnosis of epilepsy, particularly if patients are having seizures at night. You know, I think families are looking for, and patients are looking for some autonomy. You know, a lot of times those first few months after the first seizure, I mean, it feels like everybody's on lockdown. Or for me, with the families, it feels like mom's sleeping in there or on the floor next to the child, and it totally disrupts the family. And honestly, this isn't an ad for you know, Embrace too or Empatica, but that's when I feel like technology, and you know, technology specifically has been helpful for people, because that's a real fear. Like, you want to have freedom, but what happens if no one is there? Thankfully, for the most part, we know people can get injured having seizures. Most seizures stop on their own after several minutes. So we know that for the most part, we would like to hope that you're going to be safe and be okay. But I think sometimes maybe having other ways to double check that can be helpful. I don't know, Julia, if you have anything to add to that.
Yeah, no, I agree with that. And I think that having something like that, like a you know, whether it's a watch or whatever, that kind of, you know, kind of can capture what if you're having a seizure, and then alert people that are your close caregivers or family members or friends is really helpful. It's been really helpful for some of my college students when I've seen them go off to college and want to be able to do normal things. Um and so that's been one thing. I think the other thing is kind of understanding, helping people, like, this is another part of that kind of self-advocacy early on, when you know what your seizures are like, setting up your situation, your environment where you live, who you're with, what your days look like, so that you can feel as safe as possible. Of course, you're never going to be 100%, I'm not going to have a seizure in this situation, but like, if you know that you kind of have your environment set up, that can be a real reassurance too. So that's another possible way to help.
It's kind of like the lecture, I feel like I'm giving parental lectures to my college kids, right? Like, you're going to be in college. We talk about, okay, when are seizures most likely to occur? Well, if you're sleep deprived, if you've missed medication, or if you've had alcohol, those things can all lower your seizure threshold. Well, I just described like my freshman year of college, right? And so know that you should probably have medication in multiple places. So you may not be at your dorm room. Like, can you have them in your car? Can your friend keep a couple pills, right? Or, you know, try to be smart about alcohol. And, you know, and sort of, it is some of that self-care and some of that awareness where you can hopefully build in safeguards. And then the other thing too is just, the best thing you can do is to have your epilepsy under, you know, the best control possible. So, you know, we always say, you know, our expectation, if we're able to do it, is 0 seizures and 0 side effects. And so that's our goal. And I've seen a lot of patients in different places where they're sort of like, maybe not optimally controlled, but their neurologist has sort of just gotten used to like, okay, well, you just had a couple seizures this year. That's good. That's better than maybe last year, but maybe not as good as you can get. And so, you know, I would say always try to optimize for, you know, 0 seizures, 0 side effects is what we want.
I want to encourage people to, you know, if there have been studies, like one in Europe, that people who use seizure monitoring devices had much lower injury rates. You know, nothing's perfect. No technology is perfect, including Empatica technology. Neither is somebody sleeping there with you perfect. But anything you can do to get somebody there quickly when you have a seizure really is good to do. And by the way, if you're like a college student or whatever, and you're stressed about telling people that, you know, well, I haven't had a seizure in a long time, but I'm in college, you know, my sleep's changing, it may happen again. I'd really encourage people to talk about it, share, and get support on your dorm floor or in your apartment complex hallway, or, you know, next door, tell people about it, what they can do for you, be on your call list with your monitoring device. And people love to be helpful for each other. It's exactly what you guys said before. They love to be there for each other, especially I think since pandemic, people are craving, wanting to help one another. So I just encourage people to not be shy about that, you know, and ask people if you can list them on your call list, and let them know what to do if you have an event.
Or if you're a cool guy like I was in college, like would be terrified thinking of like, I'm just gonna let everyone on my dorm floor know. But
Yeah.
at least find one person, right? Like even if you're a cool guy and you don't want to get it out there, you know, at least say, is there one friend or someone that I can know? And if you can expand beyond that, great. But just start with one, at least, right?
Well, and also increasingly, there are a lot of cool people in the world who are willing to admit they have epilepsy, like you, Patrick. You're a pretty cool guy still, you know? So like, let's like refix the image around it, right? Like, hey, you can be cool and have epilepsy. In fact, tell the whole floor, you know? Like, let's
That's great.
get rid of the stigma for everybody.
Well, I'll tell you like one super fast story, but so Julia's camp story is fantastic. And I was at an epilepsy camp down in Texas, and it was a similar thing. This was a younger kids camp, but I shared my story, and it was probably one of the first times. And all those kids there like wanted to share their own story. So they had a microphone and they all came up to the microphone. They were like, I had a seizure one time at the bus stop, and they were trying to kind of one up each other almost. But I think that openness tends to invite more openness from other people. And I think if we understand that, you know, I think the first time I had to give a talk on epilepsy in Minnesota, I was super shy. I was getting my beard trimmed. I had a big old Minnesota beard. And I told my barber, he's like, what are you doing this weekend? I said, well, I'm giving this talk on epilepsy. And he goes, and I said, because I have epilepsy and I'm an epilepsy doctor. And I was like, oh gosh, I said it. But it took a little bit of courage. And he had his clippers in his hand, you know, and he looks at me, he goes, you have epilepsy? And I'm like, oh no. He said, well, I have epilepsy too. And so there I got my beard trimmed from a guy with epilepsy. Same thing. I went home and told my neighbor, I'm giving this talk on epilepsy. And my neighbor says, oh, Pam, my wife has epilepsy. So it's all around us. We're just all kind of walking around silently to
Exactly. We need to talk about it. We absolutely need to like normalize it. It should be something that, yeah, probably everybody knows multiple people with epilepsy. And if we'd talk about it, we'd all know that, and nobody would feel hesitant asking for help. By the way, in people without epilepsy who have a lot of anxiety, which is like the majority of young people these days, I think the numbers need updating. It's probably, maybe people with epilepsy have less now, but even people without it have very high rates of anxiety. And one of the things that helps them also is good social interaction and regular sleep. Two things that help them. You know, getting that kind of sleep schedule a bit more predictable and good social interaction helps reduce the anxiety. So I wanted to throw that out there too. I don't know if that's been studied specifically for people with epilepsy, but it certainly helps a lot of folks with just bad anxiety. Okay, we have a question from Ricardo. I'm the parent of a 26-year-old with refractory epilepsy. We as parents live in a fight or flight mode 100% of the time. That's stressful. The biggest anxiety is caused by the possibility of a fall and an injury. In other words, if my daughter gets 10 seizures a day, but we are guaranteed that she won't get injured, 95% of the anxiety would go away. How close are we to have a predictive wearable that would alert my daughter to sit and avoid injury? I may tackle this one. You guys can feel free to jump in too. So this is one of the holy grails. The Epilepsy Foundation did a survey years ago of their patients. And the number one thing, if I remember correctly, that patients asked for was a seizure forecasting or prediction device. There was a implant-based one built in Australia a long time ago, but it never got FDA cleared over here, and it wasn't perfect. I don't think I can say a date when there will be something perfect for everybody, because it's an open research question. We don't know how to solve this. That said, I'm super excited because we may be able to help some people with forecasting their seizures. Not today, but there was a study published by a big team, including the Mayo Clinic, using some previous Empatica devices that showed the ability to forecast better than random in a small group of people. Now, it's a very small set of people. It didn't work for everybody, and it's not perfect. Like, it can't say 95% it's going to happen. So a question we have, and Empatica is going to be launching a study next year that they're inviting people to sign up to start learning more about. You can't sign up for the study yet, but we want to start thinking about, like, how could this be done in a way when it's not perfect that would help people? Because I think, as Julia said earlier, like, even telling you when's coming can be stressful, right? So, you know, would something that gave you like a weather forecast 10 days out of a low probability seizure weekend or a low probability day, would that be good? But what if it's wrong? So these are all questions that we hope to explore. There have been some exciting findings in the literature, but there's no product. And I think now there's finally enough data that the AI and machine learning can start to train on these large data sets. And Empatica will be starting a study next year and inviting people to participate to help us explore how to, you know, how well this might work for some people. Feel free to add to that. It's a.
I'll let you handle all of the advanced inventions and computing.
The AI crazy wearable stuff. Okay. So our dream would be to help you, Ricardo, and your daughter, and everybody who feels like they would like to know, but no promises, and certainly not expectation that will work for everybody with high accuracy anytime soon. Sorry. Would love that. I would love to be wrong on that.
I think super fast though. I mean, I think his sentiment is what we see across the board, right? And you think about like parents of kids with epilepsy. I tend to think of like younger kids, but like these parents are parents of adults with epilepsy too, and it definitely impacts the entire family, not just at the diagnosis, but especially if folks have refractory epilepsy. This is like can dominate, your entire family's life.
All right, I have a question from Svern. I'm sorry if I'm not pronouncing your name right. It says, how can we do real friendship circles for those with epilepsy, Zoom or in person? Also for the caregivers, real, all caps, connections. And also, can you talk about the anxiety of SUDEP?
Yeah, I'll just talk quickly because I feel like I'm talked too much and too long, but I think that's also a holy grail for me, is the real friendship circles. I think in a way that's genuine, doesn't feel forced, and like Julia said, doesn't feel like, well, we're just friends because we both have epilepsy, right? And so yeah, I think the first step to that is being vulnerable, open to talking about it, and then we just have to keep trying and putting ourselves out there. I think if you want to go, this is my selfish plug to myself. I've got just Patrick Brown, MD. I'm trying to come up with some ways on there we can connect and talk, to just connect other people. And so, I've got some spots if you just want to share your story. There's other places around the country I know that have some support groups. I know the Cameron Boyce Foundation, as we're going to talk about SUDEP here in a second, they've got some support groups that seem to be going well. Locally, I know there's Epilepsy Foundation and Epilepsy Alliance can have some support groups, but really, I think it almost happens like on a one-on-one level, and then it can maybe just spread from there in an organic way, right? Like I know I've been involved in like some church life groups that really felt kind of goofy and artificial, because you're just sort of putting people together and you're like, well, I wouldn't really hang out with this guy. Typically. So I think the more organic they can be, I think the more fruitful they'll be.
You're making me think, as we come to top of the hour here, we should, Julia, too, dive in and share any other resources you recommend. The PAME meeting, PAME, it's an acronym for Partners Against Mortality and Epilepsy. That's tomorrow, and I believe they're streaming also. So you can go online and stream. You can watch some of their previous talks too. That is an amazing community, both for supporting people who've lost loved ones to epilepsy and for cutting edge research and methods to support families coming together to try to fight sudden unexpected death in epilepsy. In my understanding, the two things you can most do there are, number one, seizure control, take those medications, avoid triggers, things like that. And number two, make sure you're not alone at the time of a seizure. Significantly better outcomes when people are attended by somebody at the time of a seizure. We have a question from Roberta. Maybe talk about PNES with anxiety. PNES is the psychogenic non-epileptic seizures.
That's a setup question because like that's Julia's she's written books on it, so I'll let her take that one.
I want to make sure I'm answering the question. I'm not sure if the question is, does anxiety exist with PNES, or how it works with PNES. So non-epileptic seizures are symptoms that, for those who don't know what it is, they're symptoms that look and can look identical to epileptic seizures, but aren't due to abnormal electrical activity in the brain. I, in my work, view non-epileptic seizures as a form of an anxiety disorder. So I do think that we did a study of this, but even outside of the study, just my personal experience with people who have had it, almost 100% of the people who have PNES have anxiety, even though they might not be completely aware that they have it. And so non-epileptic seizures are these physical manifestations of underlying generic word stress. And so for a lot of people, that stress is anxiety. The treatment, the management of it is completely different than what we do for epileptic seizures. But within folks who have non-epileptic seizures, a large percentage of them, about 30%, also have epilepsy. So it is something that we see co-occurring. It is something to be aware of, that it occurs. It can be treated. It can go away completely for people. And so I don't know if I'm answering the question and I'm talking quick because I know we're kind of close to time, but I'd welcome any questions about that as well. If people want to funnel things to me, I'm happy to answer them.
I'm going to just ask you for any closing statements so we end on time, although we've got a whole bunch of additional questions, which we're not going to be able to answer live here. Maybe we can try to answer some of those offline for folks if the team is able to do that afterwards. But Julia and Patrick, this is fabulous having you just share your tips and experiences. Do you have any closing words or suggestions or encouragement for people out there struggling?
I just want to thank you for having me, and I want to give the message to anybody out there who's struggling to keep working on getting the help you need. I think when you feel overwhelmed and you feel lost, it can feel like there's not a lot of avenues to go down anymore, but I don't like to believe that. And I think reach out to people like us, reach out to, people in positions where they work with us every day. And we will often all try to help as much as we can to get you the support you need, the connections you need, the referrals you need, whatever. Don't give up, I guess. That's my message.
Yeah, and just to piggyback on that, I mean, you're not alone. I know lots of times in a life with epilepsy, no matter how well controlled or how refractory your epilepsy can be, it can feel really lonely. And so just know that you're not alone. There's people out here that care about you, that are here to help, that really want to help. And so reach out and don't be afraid to reach out. Yeah, but thanks for having me, guys. It was great talking with you.
Thank you both. Such a pleasure. And thank everybody for joining us. We really appreciate all of you being here, working together. It's a big community, even online. Everybody is caring for one another and we all need one another. So thank you all for working together to help improve lives for people with epilepsy.